Welcome back to Unfiltered. We are unpacking the president's speech that was delivered a bit earlier on that the country will be moving up to level 3 lockdown from midnight this evening. Next, we get some reaction from the leader of the Democratic Alliance, John Steenhuisen. John, good evening and welcome to Unfiltered. Just your reaction from what the president had to announce, us even moving all the way up to level 3, not even level 2.
And there are obviously implications for the health of South Africans, and we've got to acknowledge that. But I think the bigger question we have to ask is why we're sitting 8, 9 months, almost a year later, after the initial hard lockdown, with lockdowns and bans as the only tools in our arsenal. The big thing for me out of this evening's address by the president was the move of the vaccine's arrival. In the last speech the president gave, it was the first quarter of next year. This evening he's announced it's the second quarter of next year. Now we have to ask ourselves the question, why is there this delay? Many other countries around the world are rolling out the vaccine as we speak. Countries like Costa Rica, countries like Mexico, countries like Chile have started days ago with a comprehensive rollout plan on the vaccine. The vaccine, given the fact that the virus could be around for 24 months, as we knew from the beginning, is the only way we're going to bring some stability to South Africa's economy. Lockdowns and bans may have short-term efficacy, but they have a hugely devastating impact long-term on the economy. And we've got to ask ourselves the question, why is the focus not on expediting, spending whatever money we can throw at it, in getting that vaccine to our shores as quickly as possible, if only for the first responders in the first instance and our healthcare professionals and our teachers, but then a comprehensive rollout to the rest of the nation so we can get our economy moving and we can get life back to some form of normality again.
So what's your suspicion around why the goalpost keeps on shifting? Because the president had said, I think in his initial speech, he said early next year, and then the minister then came and the minister said the first half of the year. So certainly the goalpost is shifting, but what's your suspicion around that, why it is shifting?
My suspicion it's shifting is because, as we know, there's been 2 missed payments and we're also relying on other countries, etc. And we seem to be part of this collective. When I would think that the best thing for us to be doing is to be getting out there like Chile, like Costa Rica, like Mexico, like Canada, like Greece, like Cyprus and like Israel, and get the virus, get the vaccine to this virus as quickly as possible. By the time that the virus hits South Africa's shores, most of those other economies are going to be well on the way to recovery because they're going to be able to have comprehensively dealt with the virus. And I think South Africans have got a serious question to ask their government, is that you keep asking us to sacrifice so much, our jobs, our livelihoods, our businesses, and the like, our investments, and yet you have no comprehensive timeline for us about when the vaccine's going to arrive, which vaccine governments decided on, and what the rollout plan is. We were so busy banning roast chickens and telling people what they could wear and what they couldn't wear, stopping the sale of cigarettes, whilst other countries were busy preparing a rollout plan for when one of the vaccines came. There are 4 available vaccines now that have been rolled out in different countries across the world.
Okay.
And yet in South Africa, we're going to have to wait till the second quarter of next year before we're even able to get that first small 10%.
Well, thank you so much for your time there, John Steenhuisen, the leader of the Democratic Alliance. Next, we're in conversation with Vuyani Pambo, who is a spokesperson of the EFF. Vuyani, good evening. Welcome to Unfiltered. The last time we had a conversation on this show about the announcement that was made by the president, one thing that you were quite clear about is that there should be a ban on the sale of alcohol. What's your reaction to that announcement today?
Well, as you noted out, Adrian, thank you very much for having us. We welcome the move to level 3. It is long overdue. In fact, if anything, it should have come earlier on this month. It should have come in December. By now, we should be talking opening up. In fact, we wouldn't have reached the 1 million, or rather, we wouldn't have reached the 1 million mark of infections. So what we have now, what is here to, or rather, what is clear to see is that this government is publicly and openly always saying that, the public needs to, adhere to regulations. One of the reasons why we're going to lockdown is precisely because the government gets an opportunity to prepare the health system, so much so that it is able to, cushion the infections that are expected. It is the very same government, when we went into the first lockdown, that said to us 85% of South Africans are going to be infected with coronavirus. But we must ask the question now, how many hospitals have been built in preparation for such infections? So we welcome the level 3 lockdown, but what is also to blame for these infections that have now reached 1 million is precisely because the government has failed to enforce the regulation, but not only to enforce the regulation, but to be able to take decisive action. They should have by now put in the regulations in place, especially level 3, by the beginning of January of December. By now we would be opening and we would be dealing with lesser numbers. Mm-hmm. So we do have a government here which does not take responsibility. It has not built a single hospital to be able to cushion what it knew was going to happen. It knew that 85% of South Africans were going to be infected with coronavirus, and it did not do one significant thing, which is to build hospitals, is to make sure that we have enough oxygen tanks, is to make sure that we have enough ventilators, and to be able to cushion what it told us that is going to happen, which is the rise of infections.
Vuyani, just quickly, unfortunately, we're running out of time, but what's your message then to a tavern owner who says that this is what I rely on to make an income?
The government must take responsibility for failing the tavern owners. It must now find ways to meet with the tavern owners, to meet with that sector, and make sure that it cushions that kind of a loss. Because if the government is to blame, the government of the ANC should have been able, to cushion this kind of a situation. There is no need for us to be where we are now. By now, we should be opening the economy even further if we're closed in December. But because the government is indecisive, unimaginative, and unproductive, not productive enough or proactive enough to be able to, foresee that we are now headed for a rise in infection. But because it pleases white monopoly capital, it pleases the Stellenbosch mafia, it has not been able to make sure that it is able to take care of everyone in that sector.
Okay.
So the tavern owner must know that they are where they are because the government of the ANC has failed to make sure that it takes them into confidence and make sure that they're able to cushion the challenges that they're faced with now.
Okay, Vuyani Pambo there, the spokesperson of the EFF. Next, we're in conversation with Naren Singh from the IFP. Naren, good evening. Welcome to Unfiltered. Your initial reaction to that announcement coming from the president that the country will be moving back to level 3?
Well, Aldrin, firstly, it's very good for those of us who want to sit in our ivory towers and criticize everything that's being done around us. I think each one of us has to take individual and then collective responsibility for what is happening. Indeed, drastic measures were announced by the president, something that we did not expect. However, we believe it as the IFP that it is necessary to try and curb the rising numbers of people that are dying and the rising number of people that are being admitted to our medical institutions.
Mm-hmm. From the announcement that was made by the president around the various hotspots, including those in KZN, are any of the municipalities where you govern affected?
Yeah, we will have to study the hotspot areas and the restrictions that are imposed, and also look at what the adjusted level 3 means. And then we will get more information tomorrow when the ministers announce, and also when the Gazette is published. However, I think an area that the president missed is saying something about a safety net for those that would be losing their jobs, those that would be affected, particularly in the tourism and hospitality industry, because the psychological and economic trauma will be very great for those people to bear. And I think he missed an opportunity, although one can understand where the focus is on saving lives, but he missed an opportunity to tell us, and we hope he does that in the next few days. And the other thing is, setting up more quarantine facilities. I think we failed in that regard to have quarantine facilities like, tertiary institutions and razors and things like that, which could be used in a time of crisis like this.
Well, Naren Singh, thank you so much for your time. Actually, earlier on this morning was in conversation with the Limpopo MEC for Health, who said that as it stands at the moment, when people will be travelling back through the province and using the province border posts, unfortunately, they don't have those sites that could be made available for people to isolate. Let's move over to Bantu Holomisa, who is the leader of the UDM. General, good evening and welcome to Unfiltered. The announcement from the president, what's your take on it?
We have taken note of threats to deal with those who break the COVID-19 pandemic regulation. It's high time that the law enforcement agencies must enforce this regulation because these careless people are causing a lot of deaths in the country. So we support him on that. On the issue of the vaccine, I must confess I'm a little bit disappointed that this country would even go to the public and boast of setting aside an amount of 200 million rands. What is that? Because that money is too little. And secondly, we should be conducting directly the countries which manufacture this vaccine, instead of going to another group of people who are going to decide. I don't know, sometimes I miss Matiba's period. If Matiba was around, he would pick up the phone and speak to the Russian president, American president, Prime Minister of Britain directly to say, we're in crisis, we want your assistance. We are not going to wait until second half of next year.
Yep.
That's not on. Because what is going to happen now, what we are going to witness, is the looting spree by the comrades in corruption, giving tenders to their friends, which are even more than that 200 million earmarked for the vaccine. We need to do something better.
Yep. Okay, something like what, quickly?
At least we should be now going direct to those countries and say they must deliver those drugs, those vaccines to South Africa, and we are ready to pay. Set aside an amount of at least $500 million to deal with that. Okay. What happened to that $500 million grants which was set to be earmarked to deal with the coronavirus? The Minister of Finance was telling us that no, it's not more than 3 billion rands which have been spent. Why can't they use that money to get the drugs?
Okay, thank you so much, there, General Bantu Holomisa there from the UDM. Next, we're in conversation with Pieter Groenewald from the Freedom Front Plus. Pieter, good evening. Welcome to Unfiltered. Your reaction to the President's announcement?
Good evening. Well, firstly, there is quite a lot of uncertainty. The President mentioned that there will be adjusted regulations being published. We will first have to see what those regulations consist of. There are quite a lot of questions already asked. For instance, if you look at the previous level 3, the businesses like, for instance, hairdressers, garden services, and all those sort of services were prohibited. But the President did say that we should not have a negative effect on the economy. So I presume those businesses will still be open. And again, I say we will have to see the final regulations. The second thing is, it is quite clear. The fact that we are jumping from a level 1 to a level 3 is again proof that the government was not prepared for this pandemic. They knew before what is going to happen. There's also confusion as far as the figures and the statistics are concerned. The President said it is in the increase. The fact of the matter is that the Department of Health, on Christmas Day, we had a peak of more than 14,700 new infections. It has already decreased until Sunday to 9,500. So as far as the Freedom Front Plus is concerned, there's already a flattening of the curve. I must say that we are in favor of a can I say, a hotspot identification, a specific risk analysis of specific areas, and then you can then have certain restrictions in those specific areas, but there should be no restrictions or regulations that can be detrimental to the economy. We just cannot afford another fiasco like we had previously in this year. There's also uncertainty as far as travel is concerned. On the level 3 regulations previously, people could have not traveled over certain provincial borders and everything. A lot of people are actually on holiday. I presume that they will be able to travel back to their homes. But I should have expected from the president to have very clearly stated that that can still happen. And lastly, I want to say that it is quite clear that when we talk about our health services in South Africa, that South Africa is just, it seems, not in a position to deal with pandemics. And our policy has always been that there should be strict protocols as far as health are concerned, and that people had to adhere to that. The question is, those health protocols, safety precautions were in place. Why didn't the government enforce it properly? Now that we have an increase of new infections, suddenly now they say there's going to be strict enforcement. That should have been done from the first instance when those protocols were announced. It's no use waiting till you have a specific problem. Now, I also want to say that if we look at the statistics, yes, it's true. At this moment, South Africa has more than 1 million people that has been tested positive for the COVID-19 virus. But we must see it also in perspective. When we're looking at the actual cases, then we're talking about 130,000 people actively infected at the moment.
Yep.
And those are according to the statistics of the health department.
Okay. Peter, unfortunately, we've run out of time, but thank you so much for your time. That is Peter Groenewald from the Freedom Front Plus. We go to a quick ad break. When we come back, we'll give you some analysis around what this means for the country.